Hello and welcome to this video. Today we're going to talk about a very common but extremely painful condition known as kidney stones. You'll learn what they are, why they form, what symptoms they cause, and how they can be treated naturally. So make sure to watch till the end if you or someone you know suffers from kidney stones. A kidney stone is a hard, crystal-like mass that forms inside the kidneys when minerals and salts in the urine stick together. Our kidneys normally filter waste and extra fluid from the blood to make urine, but when the balance between water, salts, and minerals is disturbed, solid crystals start forming. Over time, these crystals can grow and turn into stones. Kidney stones can vary in size from a grain of sand to as large as a golf ball. Small stones may pass through the urinary tract without much problem, but larger ones can get stuck and cause severe pain, urinary blockage, and even infection. There are several possible reasons why kidney stones form. One of the biggest reasons is dehydration. When you don't drink enough water, your urine becomes concentrated, and minerals and salts don't dissolve properly. They start sticking together, forming small crystals that gradually turn into stones. Diet also plays an important role. Eating too much salt, animal protein, or processed food increases the risk of stone formation. High sodium levels raise calcium in the urine, and excess animal protein raises uric acid. Family history also matters because genetic factors can make some people more prone to forming stones. Obesity and lack of exercise are other important contributors. Being overweight or leading a sedentary lifestyle can affect how your body handles minerals like calcium and uric acid. Certain medical conditions such as urinary tract infections, gout, hyperparathyroidism, and digestive problems also increase the risk. Some medications, including calcium-based antacids, vitamin D supplements, and diuretics, can raise calcium levels in the urine and promote stone formation. There are 4 major types of kidney stones. The most common are calcium stones, usually made of calcium oxalate or calcium phosphate. Foods high in oxalate, such as spinach, chocolate, beets, and nuts, can increase their formation. Uric acid stones form when urine becomes too acidic. Eating a lot of red meat, organ meat, and seafood can raise uric acid levels and lead to these stones. Struvite stones usually form as a result of urinary tract infections and can grow quickly, becoming quite large. Cystin stones are rare and occur due to a genetic disorder in which the kidneys excrete too much of an amino acid called cystin. The symptoms of kidney stones depend on their size and location. Small stones may pass without much notice, but larger ones can cause severe pain that comes and goes in waves. The pain is often felt in the side, back, or lower abdomen, and it may radiate toward the groin. Many people describe it as one of the most intense pains they've ever experienced. Other symptoms include burning during urination, blood in the urine that can make it look pink, red, or brown, a frequent urge to urinate, nausea, vomiting, and sometimes fever or chills if an infection develops. To confirm kidney stones, doctors usually recommend a few diagnostic tests. A urine test can detect crystals, minerals, and signs of infection. A blood test helps identify high levels of calcium or uric acid. Imaging tests such as ultrasound, CT scan, or X-ray are used to locate the stone, measure its size, and plan treatment. These tests are important to understand what kind of stone it is and how large or dangerous it might be. The treatment for kidney stones depends on the size, type, and severity of the condition. Small stones often pass naturally. Drinking plenty of water, at least 2 to 3 liters per day, helps flush them out. Pain relief may be required, but in most cases, small stones will pass on their own within a few days or weeks. For larger stones, medical procedures might be needed. One common method is shockwave therapy, also known as lithotripsy, which breaks stones into smaller pieces that can pass through urine. In rare cases, surgery may be required if the stone causes severe obstruction or infection. Homeopathic and natural treatments can also be very effective. Homeopathy focuses on treating the underlying cause that leads to stone formation rather than just removing the stone. Remedies like Berberis vulgaris, Canthres, Lycopodium, and sarsaparilla are commonly prescribed depending on the patient's symptoms. These remedies help dissolve small stones, relieve pain, and prevent recurrence in a gentle, side-effect-free way. Preventing kidney stones is much easier than treating them. The first and most important step is staying hydrated. Drink 8 to 10 glasses of water every day. Lemon water is especially helpful because it contains citrate, which prevents stone formation. Limit salt and animal protein in your diet. Reducing red meat, seafood, and salty snacks can greatly reduce your risk. Avoid foods high in oxalates such as spinach, beets, and nuts, especially if you have had calcium oxalate stones before. Maintaining a healthy weight through regular exercise and a balanced diet is also crucial. Do not hold urine for long periods because this allows minerals to accumulate in the bladder and form crystals. Limit sugary and carbonated drinks, particularly colas and energy drinks that contain phosphoric acid, as these can alter the body's mineral balance. If you've had stones before, try to get your urine tested regularly to monitor mineral levels and stay one step ahead. Kidney stones can be extremely painful, but they are not impossible to manage. With the right lifestyle, diet, and natural treatment, you can prevent their recurrence and keep your kidneys healthy. Remember, prevention is always better than cure. Drink enough water, eat smartly, and stay active. If you ever experience severe back or side pain, burning urination, or notice blood in your urine, consult a qualified healthcare professional immediately. Thank you for watching. Make sure to like, share, and subscribe to this channel for more informative health videos. Stay healthy and take care of your kidneys. They silently do one of the most important jobs in your body.